Yes, the pandemic woke up a lot of people to the importance of a strong immunity. And yes, lots of treadmills and Pelotons were sold. But the question was, how long would this fad last? Would it become a long term trend that would impact the declining health of America? Well, we've got the answers, courtesy of NPD, as their latest study reports that spending on health and wellness remains higher than it was pre pandemic by double digits. Sales revenue doubled for air purifiers, massaging appliances, free weights, and sound machines. However, when we take a look at two important areas, the foods that we eat and our kids, the story isn't so rosy. A new report published on March 14th in JAMA Pediatrics that studied a total of almost 175,000 children found that between 2016 and 2020, there were significant increases in kids diagnosed anxiety and depression, decreases in physical activity, and decreases in caregiver mental and emotional well-being and coping with parental demands. Of course there was. These parents were working at home. Those demands were huge. And frankly, it altered that whole family unit. After the onset of the pandemic, specifically, there were significant year-over-year increases in kids diagnosed behavioral or conduct problems, decreases in preventative medical care visits, increases in unmet health care needs, and increases in the proportion of young children whose parents quit, declined, or changed jobs because of child care problems. The pandemic worsened eating disorders, according to the National Eating Disorders Association, among Hispanic, Black, and Asian populations, who are about as likely as white people to have eating disorders on a normal basis, but they're much less likely to receive professional help, especially on college campuses, where treatment is hard to obtain, especially as many programs rely on family support, and often these students are very far from home. University of Wisconsin has initiated a telehealth support group to alleviate the problem and offer support. According to the Eating Disorder Center at the university, the rise in eating disorders is connected to higher rates of depression and anxiety, as well as isolation and reliance on social media for interaction, and the stress of the pandemic. Now, the pandemic's long-term effects on our population are greater than we're estimating, and the role of the resources in every supermarket in the nation should be amplified to help solve the problem.